It's a slight beat. Hey girl,
Hey, Chief.
what's going on?
What's up? Nothing.
How are you?
I'm finding you.
So we just are letting the people get logged on and join in. If you're joining in with us, please go share with your networks or your people to get them to
Yes,
join and run the views up
yes. Because we live, baby.
live.
We live. Yes.
Okay, so we're gonna give people maybe like what you think about 2 minutes.
Yeah. What time is it? Okay, yeah.
Okay.
Okay. I'm loving the grass.
Yeah, I wanted to be in the safari.
Safari.
Yes.
That's what it was. Yeah.
Okay. So we'll let them join in.
Oh, yes. Thank you.
Yeah, I don't have any lashes
I was trying to.
on. Say shit I need to put an
No,
order in.
because the red is, yeah,
Thank you. It's given.
it is.
Thank you, Mo.
Yes.
We're representing for Real Talk and
Yeah.
Whitman-Walker.
Yeah.
Okay, so as people are joining in, we want to thank you all for tuning into our live. So I would give a little snapshot of who I am. I'm Chiquita Reed, better known as Chi. Many of you guys know me as Chi. If you don't, well, now you get to meet Chi. Sipsy with Chi. So I am the youth prevention supervisor over in Eastern Market, which is our youth drop-in center, located at 651 Pennsylvania Avenue, Southeast. And I'll let my co-host introduce herself.
Yes. So, for those who don't know me, my name is Jamyia Kennedy. I am a peer ambassador over at the Youth Center in Whitman-Walker. Um, I've been working here for a couple months now. My job just really consists around outreach to the youth, spreading our words, spreading information about sexual health, about health in general. So during the past few months, Women Walker's community health department has expanded our outreach efforts to the social media platform. We have covered various topics about HIV, STI, and sexual health practices, access to care, social determinants of health, and general public interventions. The next series of outreach sessions will focus on the current pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. The community health team is here to educate and support you.
Yes, education.
Yes.
So one thing we failed to do because we want to be inclusive to all of our community, we
Yes.
forgot to state our pronouns. Maya, how did we
Oh my
forget
God.
that? Okay,
Yeah.
so again, I'm Chi, and my pronouns are she, her, hers.
Yes. And again, my name is Jamyia, and my pronouns are also she, her, hers.
Okay, so today we're going to give it to you about the COVID-19 and the effect on mental health.
Yes.
So we know that there has been a lot of fear and anxiety arising with a new virus that spreads. So COVID-19 being extremely alarming based on how fast the virus has spread and the massive amount of data that has been behind it. So according to the CDC, COVID-19 has a great effect on many of our mental health that falls into these categories. Would you like to share the categories, Maya?
Yes, of course. So, according to CDC, again, those categories are fear of you and your loved one's health, changes in your sleep pattern and diet, increased substance abuse, with things like alcohol, cigarettes, and any other drugs, and also worsening of any chronic health conditions and your mental health.
Okay, so we know that everyone reacts to stress differently. So just because one may respond differently to the ongoing pandemic, it shouldn't discourage you, but encourage you to
Yeah.
cope with your stresses in your own healthy way.
Yes. So, different ways to cope with stress include taking small breaks here and there. Try not to overload yourself with information. Like, take breaks from watching the news or reading articles or stories about everything that's going on. And also remember to take care of your body. In addition to your mental health, your physical should also be on point, and of course at ease as well, because having extreme anxiety with other mental stressors can result in a poor wear on your body.
Yes. So the first thing we would like to remind you all is to meditate.
Yes.
We can't stress meditation. How many of you guys meditate on here? We're going to open it to the audience. I
Yeah.
know y'all didn't show up to be quiet.
Yes. Oh,
Oh, well, we don't see no hands.
I
Okay.
do.
Okay. We see you, Mr. Moore, in the
Yeah.
comments. Okay. We see you, Cheese. We appreciate you guys sharing that, you
Yeah.
guys. Okay. Zamon
Say.
So basically, there are numerous videos on YouTube to assist you with meditations. Your headspace is very important, and it will allow you to disconnect from the news and what's going on, as well as there are other applications that you can download on your phone that coaches you through how and when to meditate throughout your day.
Yes. So another coping mechanism is to eat healthier. Like we said before, take care of yourself, take care of your body. So one way that I've been trying to eat healthier, I've been making smoothies a lot. I've been real big on like the frozen fruits and the yogurt and almond milk, granola, things like that. So I've been trying to start off my day with a nice little boost of some fruit.
Energy.
Yes.
So I ain't even going to lie to you all. Before this, I was not eating enough. And what I noticed is that it's very important to get a well balanced meal. The meal consists of breakfast, lunch, and dinner. Breakfast is the most important meal of the day. And oftentimes we fail to eat breakfast because we're oftentimes rushing. And
Mhm.
so with my work from home, alternative schedule, I've now been able to implement more meals in a day, covering my breakfast, lunch, and dinner, and some snacks. My snacks are consist of maybe like some fruit, some veggies, and
Yes.
some nuts. As I explained in reference to nuts, I'm talking about almonds or cashews. Yeah. So as we know that some of us are fortunate for resources for food, a lot of people in the community are not as fortunate, and because of that, we would want everyone to have access to food. So there are resources that are available for you guys if you shall need them. You can always monitor the Whitman-Walker Health website, or you can call our resource line that we will ping at the bottom for you.
Yes. Another tip for coping: exercise. We know that a lot of people cannot exercise maybe the way that they want to, and not even speaking about just like working out. Just in the sense of getting out your bed and getting up and moving. So one way that I've been doing that, because of all the social media outreach that we've been doing, I've been on TikTok all day. I've been
Oh,
on
it's
TikTok.
TikTok. Oh,
Yeah,
wait, hold on.
yeah,
Uh, uh,
yeah,
oh, that.
yeah. I've been doing that. Yes, all the dance, learning all the dances.
Okay, so I'm not a TikTok guru, so I'm not sure. Are you all
Yeah,
on
y'all be
TikTok?
on TikTok?
Because I know a lot of my friends are on TikTok, and I be thinking that people on TikTok be looking real crazy because I don't know how to do it.
I'm gonna teach you how to do it.
Okay, you want to teach
I'm gonna
me?
teach you how to do it.
So what I do is, so I live in an apartment complex. So we have on-site laundry. So oftentimes I get my step in going up and down the stairs, washing clothes. Everyone is not fortunate to have a house. God willing, I will have a house. But everyone isn't fortunate to have a house, and oftentimes we don't take advantage of the resources that we have around us, like going up and down the stairs, walking the community, all of those things. Just getting some fresh air.
Yeah, so you can take your steps, and I'm gonna do my TikToks.
Okay. So I'm
Yeah.
gonna be like, and then I'm gonna be like, how you do it?
What you want? What you want to do?
I want to do that one. What's that one?
That's good. What you want to do? You want to do renegade?
Yes. Greetings from the Transatlantic DMV. Thank you for
Yeah.
joining. Um. Yeah. So let us get back to with the topic, and we'll open it up to the audience soon. To ask you all some questions. So did we cover adequate amount of sleep?
No, we did not.
Okay, so it's very important to
Yes.
cover um about sleep. Anybody that knows me personally knows your girl can tear a sleep up. Oftentimes my friends are telling me, "Oh, Chi, you're hard on the sleep." So yeah, I love to sleep, but it we should be getting 7 hours or more of sleep. According to medical news today, sleep is extremely vital because it gives the body a chance to repair and be ready for the next day.
Yeah.
So yeah, y'all
So
need to be getting sleep.
I've
Please be hard on it.
I've noticed that for myself, and I think for a lot of other people, it's been hard to like keep up with the time of the day or just the days of the week in general because we're all cooped up in the house and you're just losing track of everything because like every day is the same. So I've been up at 4 in the morning for no reason at all. Like so I it's definitely been hard.
And
Just
I've been up at 3, and then
yeah.
we have to go back on at 9.
Yeah,
So that's not enough sleep.
it's
So
definitely not. So don't be
we
like
aren't preaching from the choir. We have some things that we need to work on,
us.
but we would like the community to also share how they've been dealing and coping too.
Yes. If you all have any other like ways to cope with this stress, go ahead, comment them. Let us know what y'all been doing. You know.
So the next one is avoid substance use. So substance use gets a little tricky because we don't want to be telling people what they should and shouldn't be doing. However, we know that a lot of people that do participate in a lot of substance use, they use that as a coping mechanism. And again, we are not here to judge anyone. We're here to give you guys resources. So if you are using substance as a coping mechanism, you may want to, refer to the resources that we have here at Whitman-Walker to get you through, to kind of ease your mind, because you have to relax, you have to breathe. I think oftentimes we don't take time to breathe in a day because there's never enough hours in a day to breathe.
Yes.
So again, we would like you guys to check out our website, womenwalker.org, and to hit our resource line up. Don't ever feel like you're in this alone.
Yes. So one last tip that we do have is to make time for yourself to get some peace. One way that we have found is, okay to do that is to connect with your loved ones. Because everything is going on, we definitely have to do that virtually, of course, because the virtual world is taking over. But whether it's just checking up on them or just venting to them, Everyone is worried, so I believe expressing yourself during this time is definitely a way to lead to a calmer state of mind.
Yes, all of those things are great. So I see in the comments we have like some people are saying they're decluttering, that they've connected with friends more, and all of those are great ways to, cope with what's going on. And oftentimes chatting with a friend or a close family member that you feel comfortable and safe with, because we do have to honor that some people that are at home aren't always in a safest space.
Yeah.
So just being able to connect with someone in a safe, confidential way is always, we can't stress it enough.
Yeah.
But again, we have resources, resources, resources.
Yes.
Don't forget to follow us on these pages either. We'll share our pages later, and where you can get more resources at also.
Yes. And in addition, for us who are like you say, in a space where we don't feel as safe as we usually do, another good way is to just check in with our chosen families. And that, of course, that may not be the families that we are with right now, but our chosen families are still our families, and it is important to still, remind yourself that you are a part of that family, and that is speaking towards our LGBTQ communities, our everything.
Yes, because I have a lot of children that did not birth, but I also know their birthdays. Okay,
Yes.
so we want to the next topic of discussion is quarantine and the effects on mental health. So for those with mental illness, and even those without, because some of us will not connect to that, it's a lot going on. So being stuck in the house and with the curfew order, does not help the improvement with one's mental state in a time like this.
Yeah.
So there has been research proving that, according to the Washington Post, and with the estimate of three jurisdictions within the DMV, which is DC, Maryland, and Virginia, Mayor Muriel Bowser stated that it is possible that one in every seven people within the district might contract the virus. So, with that being said, that there is a stay-at-home order in effect in the DMV, and all households must stay at home unless they're going to work or to pick up essential goods and anything that deems necessary for movement. So when we talk about movement, we're talking about like going outside to
Yeah.
get some fresh air, going for a walk, taking your furry pets out for a walk. We just want to also be mindful of the physical distance that we should be keeping. How many of you guys know what the physical distance should be? Because I know,
Yeah.
Mario, you know, right?
I know what it is.
Okay,
Yeah.
so would our audience know? Because y'all getting a little quiet on us.
Yeah. 6 feet right there.
Yeah, 6 feet. Okay,
Yes.
so being
So
mindful of the 6 feet distance that we should be keeping in mind when we're out, and that's just for our own safety and the safety of someone else. So research has shown that the purpose of quarantining is to prevent the spread of any more germs, especially COVID-19, and to preserve any germs and sickness you or anyone you live with has already had, and or um yeah.
yeah.
uh
So Chi, how do you think the quarantine has affected your mental health?
Girl. Let me tell y'all.
Oh, tell us. Cause look,
Oh, well,
I got my tea too.
oh, you got your tea.
Yeah, I had it.
Oh, sips tea with Chi and Maya.
Yeah.
But I just got a
So
spoon.
let's
Uh, so with the
let's
tea?
see.
Oh, girl, I've been struggling because I normally like to go get my hair done. So I had to get some
Yes.
cornrows or something that's gonna last. Oh, the nails. So for me,
Not
a
done.
manicure and a pedicure is my self care. I have not been able to go get a manicure and pedicure, and that let me tell y'all, for me, that has been kind of triggering for me because I know that there's a lot of DIYs out here, but come on, I'm not about to sit and do no DIYs to do my nails or any of that. I want to be able to get a service provided to me, and I miss tipping people that provide a service to me.
Yeah.
Also, some people have shared sipping hot peppermint tea. Yes.
Yes. That's
Okay.
wrong. Yes, we all missed that.
Yes.
Yes.
Yes. Feel my pain, sis.
Yes. I think one way the quarantine has been affecting me in a sense is because it's messing with my senior year. Like I think I know all the seniors feel my pain right now. We have been looking forward to senior year. So now that, because of COVID and because of everything that's going on, it's like in the air that our graduation may be canceled or our senior year may, I'm sorry, our prom may be canceled. It's like, it's frustrating. Like it's really frustrating because not only have I been looking forward to this all year, but I know a lot of us have been looking forward to it since ninth grade. So
Yeah,
it's
because I know I've been looking
yeah.
forward to going to prom this year.
You was going. Who said you was going?
Girl, class of 2020 is my year. Shout out to class of
Yeah, class of
2020.
2020. I see some of my seniors in here. I saw y'all. I see y'all.
Yes.
So
But don't feel sad, Maya,
yeah.
because y'all gonna push through and y'all gonna have the rebirth year. Because
Yeah.
2020 is going to definitely go out with a bang, and we're gonna
Y'all
get
gonna
through
y'all
this.
gonna remember this year. That's the
Yes,
thing. Y'all gonna
2020
remember.
goes down in history.
It does.
Literally.
It does. Yes.
So there are some possible mental health effects of quarantine. So some people feel fear, they feel sadness,
Insomnia.
insomnia, them sleeping patterns, yeah, they're
Yeah.
off. Numbness, confusion. I'm sorry, yeah, confusion, post traumatic stress disorder, anger and irritability, low mood, stress, emotional disturbance, depressive symptoms,
Yes.
and anxiety.
Yes.
Because those all are things that are real for us in this moment. Sorry, Maya, go ahead.
Fine. But so after listening to some of those symptoms, question: have any of you guys experienced those feelings? And like she just said, they're all normal, and it's okay to feel them during times like this. Um, Getting into that, there are different ways. Here are some different ways to cope with quarantine. According to verywellmind.com, which is a website for health information and tips provided by professionals, there are a few ways to cope with quarantine. One of them being to establish a day-to-day routine to look forward to. So, what's your
Oh, so my day to day is so I didn't do this before, but now when I wake up and if I have time, this week actually I had started listening to podcasts and meditating soothing sounds because oftentimes sounds can relax you. I know that I'm a big person on running water, and people that are on the phone with me are like, "Girl, you must don't pay water." I don't, so I'm going to enjoy the sound of water because that's what's soothing for me. And I wish, because we have a amazing behavior health team, I
Yeah.
wish I can get a recording of Kevin Wardolph Cruz, because his voice, like, he has the best voice ever. But to those people that are tuned in, if you are existing patients of Whitman-Walker, we suggest that you go online and check out the behavior health team. Right now, unfortunately, we aren't seeing any new patients, but the information is always updated on the website.
Yeah.
So stay tuned.
Yeah. So quick question. We just had someone ask about yesterday's live. Um, that is posted, I believe. Yesterday's live.
Oh, yesterday's live is
Yeah.
posted. And
Okay.
so our dialogue and our conversation today is,
It will also be.
yeah, will be posted as well, but the conversation is similar. The whole goal is to be well in this time of need.
Oh, right.
Um, yeah, no, you cannot.
Right.
So, disassociation and being out of it too. Yes. So we thank you all for sharing
Yeah. Yeah.
examples of what that looks like for you. We
Yeah.
can't stress enough to be active as possible. Staying cooped up in the house with no physical movement can lead to a number of breakdowns in the body. We
Yes.
know not everyone can be physical as they want to, but sitting outside for a breath of fresh air can also be helpful.
Yes. Or maybe even just like you said earlier, if you have a pet, walk your pet. That may, help. Mhm.
Okay, so how many of you know what to do with your frustration?
Or your boredom. Or your boredom.
Frustration, boredom. So, in addition to exercising, take this time to pick up a new hobby, whether it be drawing, painting, instruments, a sport, or whatever you feel is best for you. So, next week, the Real Talk DC
The-
team, we're going to go virtually live. So if you guys haven't already done so, you can go follow us at Real Talk DC _. So we're going to be doing some art therapy. We're going to be doing some group virtual game
We have Netflix party.
activities. We're going to have a Netflix party,
Yes.
Netflix and chill. Because what we found out is that virtual streaming is the new norm for us
It
to
is.
practice that physical distance.
It's taking over.
Yes.
Yeah.
Oh, cooking, reading, singing, twerking. Oh, it's working.
Oh,
Okay.
yeah.
Yeah. Okay. Yeah, coloring is also a happy place. That's
Yeah.
why you guys should tune in and join our art therapy sessions, because we really have some dope art therapy interns that really get us out of
Shout,
our creative mode.
shout out to Jenny.
Shout out to
Jenny.
Jenny.
Yes.
Okay. So another thing is keep yourself informed but not overwhelmed.
Yes.
There is a lot of information out here about COVID-19, and I know it's hard not to, um, you know, partake in a lot of it that's going on. Be informed, but don't overwhelm yourself. You have to take care of yourself and your mental health. And a lot of these the facts that are out here or the data that's being released is alarming and concerning. But you still have to check in with yourself, take it in, brief it, and then you have to see how much of it that you want to hold on to.
Yes. So that definitely goes into listening to your body. Like just listening to your body language, your what your mind is saying, what your heart is saying, during these hard times.
Okay, so we want you guys to research some free mental resources in the DMV and also on Whitman-Walker Health telehealth resources. It gives you a wide range of information on mental health that's in the area. So, for local services, the National Alliance on Mental Health has a helpline that offers free assistance and advice 24 hours, 7 days a week.
Yeah.
So, you can visit them at NAMI.org. That's NAMI.org. Or you can text NAMI, NAMI, to 741-741.
Yes. So, Chi, would you like to move into our last little activity?
So wait, we gotta tell the people where to follow us at. Me.
Yes. Yes. So, once again, my name is Jamyia, and I am a peer ambassador um, through Women Walkers Youth Services. So you can go ahead and follow me at Real Talk Maya, and that is
Oh, Real
MYA.
Talk Maya.
Yeah,
It's
because
given.
it's it's giving everything it's supposed to give.
Oh, okay.
but yes, it's Real Talk Maya, and that's MYA with a underscore.
And you can follow me, Sips Tea with Chi, at
Leave
Leave
it.
It to Chi. Because you got to leave everything to Chi. Because I get some questions in the comments that saying, where you at? I'm in the
I'm in
safari right now. I got to make it all real for me.
or the jungle.
Oh, the jungle. Oh, yeah. I got on cheetah print.
Oh,
Um,
gee, why I didn't even notice.
okay, but you can follow again me at Leave It to Chi. You can check out Women Walkers, um, Instagram, Facebook, website. You
Yes.
can also follow again Real Talk DC underscore. If there are any young people that you know that need an outlet and need to join us virtually,
Yes.
they can go to that page or they can follow either one of us. So make sure you guys stay in tune because we're gonna have more lives. And Real
Oh,
Talk will definitely go
thank
live next
you.
week. And Real Talk DC
Thank
is
you.
a program that serves young people ages 13 to 24.
Yes.
So is there? Oh, okay. You like everybody like the cheetah print.
Yeah. No, did you see JJ said cheese?
Oh, cheese, tough print.
Yeah.
Period, JJ.
Yeah.
Yes.
Yeah.
So don't forget, make sure to follow us. Can we get a pin of the
Yeah.
resources and the numbers?
Please.
Okay. So how are you guys feeling about the live?
Yeah, because
Was it informative?
I heard somebody say the live very much gives DC. Who said that?
Who said
Who said?
that?
I saw it. I read it.
Oh,
I
it
can't.
gives very much DC. Yes, because
Yeah.
I am from DC. Maya, where you from?
Um, I don't even know what's kind.
Oh, well,
Of,
you from Real Talk DC at this
yeah.
point. Yeah.
Yes.
Thank you. So
Yes. Thank
thank
you
you
guys for
for
watching.
tuning in. Make sure you guys don't forget resources. And yes, DC is definitely in the house. Is there any Maryland
Yeah.
people in the
There goes
house? Is
any.
there any Virginia people in the house? Do we have anybody that's outside of the DMV area?
Oh yeah.
So if you guys stick around for just a little bit because we do appreciate you all stopping by and tuning in because it's literally Real Talk with Maya and Chi. And we
Literally.
want you guys to be connected and we want you to feel like you have a place or a platform to share or get informative sessions, like the one today, like the one we had yesterday. And again, if you want a recap of any of the sessions, don't be shy. Click on the little window or the little circle and view them
Yes.
all and tell us how great we've done. I've been doing the work for a very long time. I'm not gonna tell you all how many years because that'll be telling my age, and age don't matter in this
We
moment
we're not
because I'm
spilling
just
that
as
type
lit
of tea.
as you, Maya.
We're
Oh,
not
don't do
spilling that
that.
type of tea.
Yeah.
Yeah.
Oh, Southeast. Now, Rod, you're trying it. So we wanted to share outside of sipping tea. What
Wait.
we do? What we be doing, Marion?
You tell you tell me. Oh wait. You want me to bring? Let me bring it out.
Yes, bring it out. Oh my God, one of my favorite directors in all time has joined. I love him so
That-
much. Everybody say hi to Bree Brinks. Yes.
Oh hey. How you doing? Yes.
Okay, so what we be doing?
What you mean at work?
I mean, no, we can't do this at work, but
Yeah.
we can do this at home.
Yeah. Okay. So let's go ahead and bring it in. Our candles. Candles are
Oh,
like, perfect for yeah. Cause I was like, where your candles?
it's right here, and I got it set
Yes.
up real nice.
Oh, mine's not that nice. Mine is like it's a little strawberry.
Oh, yeah.
It's
Presentation is everything too. So
it's.
when you guys are going live, make sure you give the people what they want.
I don't have all of that.
You know, all candle time. Anybody else
Yeah.
has some candles?
Yes. If y'all have y'all candles, go ahead pull out y'all candles. Pull them out.
Put them out. Mine came from Bath and Body Works. Anybody know if they having a sale? Because their
Oh,
candles are bomb.
everybody be having the sales right now. I think
They do.
I got this
But I
from.
also like the soy candles and I like people that make candles. So if you guys can shout out some candle vendors in a time like this, we
Oh,
definitely would like to support.
I actually do know somebody who makes candles. I do, and last I checked, she was in this live. I'm not sure if she still is, but if you want to find some homemade candles, her Instagram is at KanaeZB. That is KANAE and the letter Z and B. She has some nice homemade candles.
Oh, people are shouting out the scents, right? So I
Yeah,
got a Aloha Kiwi Passion Fruit, and this is made with essential oils. So
hey,
it's calming.
essential.
Okay. All right. So
Like okay.
I'm lighting mine. I'm lighting
Gee.
mine. Please be cautious when you do this at home. So be very cautious because I don't want this to come back and be like, oh, she said no, because I said be cautious. Yeah.
Yes, but here we are.
Yes. Yes. And we want to thank you all for joining us today. You guys were amazing
Thank
and we
you.
appreciate the dialogue. So stay tuned for more sessions. Again, don't forget to follow us on IG, Facebook at Whitman-Walker, Real Talk DC _,
Yes.
Leave It to Chi, and Real Talk with Maya _.
Yeah.
And that's on
That's on what?
period.
Yeah. That's on.
Yes. All right. Thank you
Yes.
guys and
Thank
have a good
y'all.
afternoon. Thanks for
Yes.
tuning in midday. Hope we filled everyone's heart. And you can follow us later. Be sure to check in on the resources again. I can't stress that enough.
Yes.
The number, we still don't have the pin. Can we get the pin for the number and the website? Christian Mingle. Okay, so now Maya and I are signing what?
Off.
Oh, thank
Oh,
you guys.
yes. Bye.
Bye.